Tonight,
We diagnosed her as a stage 4 breast cancer.
I don't want to die. I don't want to lose my hair. I don't want to lose my breast. How do I have cancer?
an ABC 27 special presentation.
It seems to be happening earlier in age, which is scary.
Hope and Courage, a tribute to breast health, sponsored by Penn State Cancer Institute.
Good evening, I'm Deborah Pinkerton. October is Breast Cancer Awareness Month. You will see a lot of pink this month with the goal of raising awareness of breast cancer and the importance of early detection. And there's a reason why. This year in the United States, there will be more than 280,000 new cases of invasive breast cancer diagnosed. 1 in 8 women in the U.S. will be diagnosed with breast cancer in her lifetime. And breast cancer remains the second leading cause of cancer deaths among women overall. So why are self-breast exams so important? When should women have their first mammogram? And if you are diagnosed with breast cancer, what options do you have? Well, we will answer those questions for you tonight. And viewers have questions too. Doctors from Penn State Cancer Institute are answering questions in a live web chat. To have your questions answered, visit abc27.com/breastcancerchat. But first tonight, while the risk for breast cancer increases with age, many young people are also affected. Denise McCracken has more.
Thanks, Deborah. Mammograms are not typically scheduled for women until they turn 40 years old. Thanks to self-breast awareness, one Dauphin County woman in her 30s was able to turn her observations into a diagnosis. Here's Jennifer Price's journey. Jennifer Price is a practicing nurse and a busy mom of 2 girls.
I really like to work out. I like to lift weights, spend time with my family, with my girls, hang out with my friends.
When she noticed a change in one of her breasts, the 36-year-old simply added calling the doctor to her to-do list.
I just noticed that my areolar area on my one breast was a little bit lighter than the other one. Put it off for a little bit, of course, like we all do, because we're busy, we're moms, we're a million things going on.
A few months later, Jennifer called her OBGYN for an appointment.
When she looked at them, she said, it's normal changes, but for your age, it's not. So I'd like to do more to kind of see what's going on. So she ordered a mammogram.
And that led to more tests.
So did the mammogram. They ended up having to do more images. So I knew, as a nurse, like I knew something was seen. So they did more images. They told me then right away there was a mass. So we're gonna do an ultrasound. So they were able to do that at that same appointment. Within, I don't know, a minute of that, he said there's multiple masses in there, so we'll have to do a biopsy.
We got staging studies, which included CT scans and bone scan, and we found that she had evidence of cancer spread to her bones, and so we diagnosed her as a stage 4 breast cancer.
The first thing that comes to your mind, like, I don't want to die. I don't want to lose my hair. I don't want to lose my breast. How do I have cancer? Like, just, you know, why me, why me?
She told her girls the news.
My kids are what pulled me through because I couldn't lay in bed and cry and not do anything. So my life went on very quickly. So I kind of accepted it, and it was kind of like, okay, what do I need to do? You know, you put your head down and you just kind of go, and I just listened to what my doctors told me to do, what I needed to do.
A multidisciplinary team of Penn State Health doctors discussed her case and recommended chemotherapy.
That's how we started her treatment with those infusions of these 4 chemotherapy every 3 weeks.
When I was probably 2 therapies in, I started losing my hair. But I decided to try to, again, involve my girls and make it as fun for them as it could be, because I was gonna be devastated regardless, but I wanted to make it a good experience for them.
Jennifer let them dye her hair and help cut it.
I'm sitting in the chair, like, bawling my eyes out, but they had a blast. And they even talk about, like, how fun it was when they got to, like, color mommy's hair.
Surgery was next. Doctors recommended a hysterectomy.
Our ovaries put out hormones, and those hormones can feed the cancer. Jennifer is young and premenopausal, so her ovaries are active, and so one of the ways of improving her outcome is to remove the ovaries, and she elected to have a total hysterectomy, which removed the ovaries as well as her uterus.
After healing from that surgery, the next step was a bilateral mastectomy.
So her surgery went extremely well. The operation took about 6 hours to do. combination of myself and Dr. Johnson, the plastic surgeon, who put in what we call expanders, which allow them to stretch the skin and then eventually put in implants.
Follow-up scans look promising.
In the next subsequent couple scans, we almost could not tell where the cancer was, or we could tell that it was there and is treated now, which is the best news possible.
Jennifer thanks family and friends for their constant support and also joins her healthcare team in spreading awareness.
I would say to do the self-breast exams, and if anything looks abnormal, it's better to be cautious and get it checked out, and if be nothing, then it be like I was, kind of like thrown into this like awful situation.
This is where being aware of your body and doing those self-breast exams, you know yourself the best. And if there is any change, you want to be the first one to notice that change and make sure to get in touch with your physician.
We call it breast awareness. So we ask women to be aware of what their breasts are like normally, and if they see or feel changes, then to report them to their physician.
Jennifer continues immunotherapy, but also has added more fun things on her to-do list, including a recent trip to Disney World and simply enjoying life.
The positive of living with breast cancer, I guess, is that it's definitely made me actually live more than just kind of go through the motions of life.
Jennifer continues to receive scans every 3 months, and she just crossed off being on TV from her bucket list. Back to you, Deborah.
Thanks, Denise. Joining us is Dr. Dalila Dodge, breast cancer surgeon at Penn State Health Breast Center and Jennifer's surgeon. Thanks for being with us.
It's a pleasure.
What an amazing story. How is Jennifer doing?
I think you've just seen she's doing remarkably well. We can really say that right now she doesn't have anything that looks like active disease. She's in complete remission. Her energy level is amazing. She's back to work. She's back to all of her activities. She's really living.
Yeah, living her life. Now, a breast cancer diagnosis is very scary, but surgery has really advanced. Let's talk about the different surgical options.
So for most patients, we have a choice of breast conserving option, taking out just the area of cancer, checking the lymph nodes. And in some patients who have diffuse cancers in multiple areas of the breast, or like in her case, we had really what we call an inflammatory breast cancer where it was involving the skin, et cetera. Those patients need a mastectomy. But the options have expanded. We have ways of taking out larger portions of the breast for breast conservation and still leaving a really good cosmetic result. Sometimes we do breast reduction for women with really larger breasts and give them an extra benefit. And in her case, we did breast reconstruction so that we're able to remove the entire breast, but then leave them with a reconstructed breast that brings back their feeling of being a full woman.
Yeah, just wonderful that there are so many options for women these days. Now, Dr. Dodge, you've been involved in some research for surgical interventions for stage 4 breast cancer. Why don't we talk about that?
Well, I think it's exciting because we looked at a database, the National Cancer Database, and it covers a very large proportion of patients. And we looked at almost 13,000 women who had what Jen had, which we call de novo stage 4 breast cancer. They were diagnosed already with the cancer having spread somewhere. And what we found was in those patients who did very well with systemic therapy and didn't have diffuse and multiple site metastatic disease, but that responded, if their cancer really responds to the medical therapy, surgery is of benefit. Now, there have been some small randomized trials that haven't been able to show a benefit to surgery. So the previous guidelines have said, don't do surgery for these patients unless they're symptomatic. But in Jen's case, what we saw in her PET scan was a small amount of enhancement. And we felt that the breast probably still had some cancer and that we could benefit her. We did indeed find microscopic amounts of cancer left in the breast. And I think we've benefited her enormously by doing the mastectomy.
Yeah, thank you for doing that research. Cancer survivorship really speaks to everything, including quality of life after cancer treatments for your patients. Why is this so important?
Well, life is a gift. And individuals who are diagnosed with a disease that threatens life They get a new perspective on life. Survivorship is about everything that happens after we get through the treatment of that disease and how much we can enjoy life as it goes forward. So many of my patients tell me that the flowers that come out in spring after they finish their cancer treatment are more miraculous, more beautiful than anything they've seen before. So survivorship is all about embracing those people that you know were your support and your friends, embracing what makes you happy and living your fullest life.
And your team gives them hope.
Absolutely. It is a total team effort.
Dr. Dodge, thank you for all that information tonight.
Thank you.
And for more information about Penn State Health Breast Center, or if you would like to schedule your mammogram, call 866-307-3109 or visit online at pennstatehealth.org/mammogram. Now let's check in with Denise McCracken for the answers to some viewer questions we received in tonight's web chat. Denise.
Thank you, Deborah. Well, here to answer those questions is Dr. Christine Witters, co-director of Penn State Health Breast Center. Thank you for joining us tonight.
Thanks for having me.
Our first viewer question: I know screening is important, but how do I know if I'm considered high risk?
That's a great question, and one we encourage all our patients to ask even before age 40, when they're 25 and 30. It's a complex question and involves knowing their family history, both breast cancer history as well as other cancers. Have they ever had any biopsies? Also, one thing that we ask patients know, have they ever had breast or chest wall radiation, as well as the density of their breast if they've ever had a mammogram before. We have two wonderful nurse practitioners who run high-risk clinics, both out of our Lancaster office as well as our Penn State Hershey office, that it's their full-time job to meet with patients, go over all these questions. We have a lot of different models, then we can predict their lifetime risk and make sure that the patient is getting appropriate screening, appropriate follow-up, and that we're detecting those cancers as early as we can, should they ever develop them.
And doctor, this viewer has an important question about self-breast exams. What are your tips for performing a self-breast exam, and when should I be concerned?
I was listening to the segment before this, and I really have to emphasize what Jen and Dr. Dodge were saying. We call it breast self-awareness, but it's this idea that just like any other part of your body, you have to be aware of your breasts. It involves two components. First, looking at it to make sure, are there any changes in the skin or any dimpling of the skin? The other thing that we have our patients do is just do a simple manual exam. We're not expecting them to do the same type of exam we're doing here in the office, but the idea is that you're just checking to see if there's any changes. Patients are their biggest advocate. If you feel anything, please feel free to reach out to your primary care provider, GYN, or even someone in our breast center. I cannot say how many times that we've had a patient come in that said, I just felt a lump or something just felt different. I tell my patients, I'd much rather have you come in and ask and we say it's nothing than be worrying at home about something that may or may not be there.
Dr. Witters, thanks for joining us tonight. And if you have questions, you can join the live web chat right now. Go to abc27.com/breastcancerchat. Stay with us. We'll be right back.
This is how we restore hope. This is how we protect what matters. This is how we preserve what's familiar. This is why we're always researching, learning, and innovating. This is the health we need to live the way we want. This is Penn State Health. This is Krista's happy place. This is Krista's warmth. This is Krista's heart and soul. This is Krista being a mom after cancer. This is Penn State Cancer Institute.
You're watching Hope and Courage, a tribute to breast health on ABC 27, sponsored by Penn State Cancer Institute.
Welcome back. Regular mammograms can help medical professionals better diagnose breast cancer in its early stages. One Berks County woman is thankful she didn't skip her regular exam. Denise McCracken has her story.
Thanks, Deborah. Since the pandemic began, doctors say fewer women are keeping up with their screenings. But Teresa Lazar's was faithful when it came to her yearly mammograms. Here's Teresa's journey. Teresa Lazar's is a married mom of 4, a teacher, and a world traveler.
I spent a lot of time traveling the world. We loved to sail, scuba dive.
Teresa had gone faithfully every year for a mammogram. And every year, she would get called back for an immediate follow-up. Nothing ever went further than that. Until last summer, the outcome was different. She received a phone call from her doctor.
He said, you need to go and have a second mammogram. And I said, oh, of course. Why are you calling me? I always do this every year. And he said, no, this time it's the real deal. You have cancer.
I was sitting away from it, and I'm not sure I heard clearly, but her reaction right away, I knew that this was a big problem. And I knew that what we had to do now was find out how serious this was.
So I was shocked.
Teresa and her husband went to Penn State Health Breast Center for additional images, and a biopsy confirmed the diagnosis.
And they just told us that it's the worst possible news we can give you. And they said, you know, you have cancer. And I said, well, I can't do this right now. I said, I have to go to the Bahamas.
Teresa's family already had a trip planned, so she kept her plans and decided to start treatment when she returned. While in the Bahamas, a seashell she found, resembling a chest, became a sign that everything was going to be fine.
The one breast looked like it's off and the other one's on, and it washed up to my feet. I said, it's a sign I'm going to be okay. I took that every day to my cancer treatments.
Her stage was not a stage 4, so when we are a stage 2, a stage 3, we are looking at attaining a cure. And we are talking about doing chemotherapy first to try and shrink the tumor as much as we can.
I would be there for hours and hours. And when you go for the treatment, you go, you always have your blood work done, and then you see the doctor, and then you have your treatment. So you're there a long time, a good portion of the day.
Treatment took a lot of time and also had a lot of side effects. Her family was a constant support.
Sometimes I just wanted to give up. I just did. I was so sick. But they would say, we're going to fight it together, you know. So we did.
The treatment itself was kind of brutal, and then she was up and down with her own psyche. And so I kind of followed that too. But I tried to all the time say, you can do this. You're a tough person. Let's do this together. Don't give up.
Teresa's brother even came to her rescue at one appointment.
He came with me, and I had forgotten my ball cap. So he and I got to the hospital. We ran to the gift shop, and we bought ourselves matching ball caps.
After 6 cycles, she got that 1 infusion every 3 weeks. After 6 cycles, we were able to take her to surgery.
And by doing that, we were actually able to completely get rid of the cancer even before surgery.
Teresa would now have breast conservation surgery, an option to a mastectomy and an outpatient procedure.
We were then able to do breast conservation for her, a lumpectomy, as well as check her lymph node, which had no cancer. And of course, she actually had no cancer left in her breast either.
And I really didn't have any issues. I didn't really have serious pain issues, and it healed very, very quickly.
Her next step, radiation therapy.
In order to make sure there aren't any little cancer cells that could still be in the breast, the radiation is an insurance policy for those.
This experience has given Teresa inspiration to see more of the world with her family.
I quickly made arrangements just to get away for 2.5 weeks. I'm going back to Croatia.
I could see a light at the end of the tunnel, I guess I would say. Things are looking better.
Teresa and her doctors have a message for other women.
Anyone who has cancer knows that once you have cancer, you are always looking over your shoulder, always.
Go ahead and get your mammograms. I know it is again, a scary moment if you get a call back, but this is where we can change the outcome, we can make a difference, we can catch it early, and you will also have an outcome like Teresa.
Teresa says the only thing she misses about her chemo appointments is the amazing staff that she now calls friends. Back to you, Deborah.
Thanks, Denise. Joining us is Dr. Melody Polishak, breast surgeon at Penn State Health Breast Center, and also Teresa, surgeon. Thanks for being with us.
Thanks for having me.
Let's talk about the team approach for breast cancer treatment at Penn State Health. Why is that so important?
There are so many aspects to treating the whole patient with a breast cancer diagnosis. So Penn State Health, we really collaborate from radiology, pathology, navigation, medical oncology, surgery, radiation oncology, so on and so forth, all the way through to survivorship so that we can really tailor our care to that individual patient. And we also want our patients to know that they have that whole team behind them.
And now you're treating patients on the West Shore with Penn State Health Hampton Medical Center and Holy Spirit Medical Center. Talk about that.
We are really excited to bring services to the West Shore and also to get to partner with Dr. Angela Soto Hanlon and her wonderful, wonderful team. Through that partnership, we know that we can bring additional services to all of our patients, and we can do it closer to home for them.
And doctor, in your opinion, what makes your team so special, and why should someone choose Penn State Health Breast Center for treatment?
Our team is so special because we're really like a family that's come together for the good of the patient. We know we can count on each other, and we hope that the patients feel that too, and that they want to become part of our family.
Okay, Dr. Polishak, thank you so much for all that information.
Thank you.
And for more information about Penn State Health Breast Center, or if you would like to schedule your mammogram, call 866-307-3109 or visit online at pennstatehealth.org/mammogram. Now let's check in with Denise for the answers to some more questions. How's it going over there, Denise?
Thanks, Deborah. We're busy. We've received several questions so far during our live web chat. And here to answer some of those questions is Sarah Sheets, breast imaging navigator at Penn State Health Breast Center. Thank you so much for joining us, Sarah.
My pleasure.
Our first question, what does a nurse navigator do for patients?
Okay, so my role is initially to meet with patients at the time of their diagnosis or follow up with a phone call if they've received their diagnosis over the phone. We sit and talk about the next steps, and I arrange their initial visits with the surgeon and any additional imaging that they might need. Doing so alleviates some of the emotional burden of getting a diagnosis.
This next viewer has a question about the diagnosis. How do you help patients handle the emotional struggle after the diagnosis?
A good question. So one of the most common emotions that we see after a diagnosis of breast cancer is fear. Fear of not only the diagnosis, but of the treatments that come with it. And so part of my role allows me to educate patients on the disease process and everything that's going to be coming up for them. And in doing so, allays a lot of the fears of the unknown.
Sarah, thank you so much for joining us to answer our questions tonight.
You're very welcome. Thank you.
And doctors will answer your questions until 8. So if you have a question, you can join the live web chat right now. Go to abc27.com/breastcancerchat. Deborah.
Thank you, Denise. And joining us is Dr. Julie Mack, co-director of Penn State Health Breast Center. Thanks for being with us.
Great to be here, Deborah.
And as we know, screening is really the key to early detection. Tell us why it's so important.
Well, what we know from the studies involving screening is that there are 30 to 40% fewer deaths due to breast cancer among women who routinely go to screening compared to those who don't undergo screening. So that's really the purpose of screening. It's to reduce deaths due to breast cancer by detecting breast cancer early when treatment is most effective.
And you really have so many locations available now for people to go to. Why don't you talk to us about that?
Yes, and these have been mentioned in part on the previous sections. Dr. Polishak said we're now at Holy Spirit. Hamden Hospital just opened. We are also at Camp Hill, Carlisle. In Berks County, we're at St. Joseph's in Exeter, and we have a site in Lancaster County at Lime Spring. We have a newly opened site at Union Deposit Diagnostic Center. And of course, we have both the breast imaging and surgical consultations at our Comprehensive Breast Center at Hershey.
Now, some women have dense breasts, and sometimes they require additional imaging. I can certainly relate to that. How do you handle those cases?
So the most important thing about breast density is the patient should be aware of what their breast density is. It's only a question that can be answered with a mammogram. So the mammogram is able to determine if you have not dense breast or if you have dense breast. The difference between those two are important. People with the densest breast have a slightly increased risk of breast cancer. So in those patients, they certainly should be getting their mammograms, but some of those should also receive supplemental screening. Supplemental screening can be it is always in addition to the mammogram, but it can involve ultrasound or MRI.
And Dr. Mack, if you could leave our viewers with one message tonight, what would it be?
So I think the message to take away from tonight is to really take charge of your own breast health. Talk to your provider about your risk profile, know your breast density. If you're due for a mammogram, don't put it off. October is Breast Cancer Awareness Month. It's your reminder to take the time to take care of yourself.
That's absolutely right. A very important message. Go get your mammograms if you haven't done it.
I agree.
Thank you, Dr. Mack. And thank you for joining us tonight. We also want to thank Jennifer and Teresa for sharing their stories, and you, our viewers, for sending in your questions. And we also send a special thanks to all the healthcare workers who are working during this pandemic. And if you would like more information, or if you would like to schedule an appointment with Penn State Health Breast Center, call this number 866-307-3109. or visit online at pennstatehealth.org/mammogram. And you'll want to tune in to Good Day PA this Friday and meet the director of Penn State Health Lifeline as they celebrate an important milestone and learn about the new pediatric ambulance that helps transport kids at Penn State Health Children's Hospital. And again, that's this Friday at 10 o'clock right here on ABC 27's Good Day PA. We want to thank you for watching tonight, and we wish you good health.